What an FD would expect from the practices within the North East and North Cumbria. These 4 main subjects relating to this are as listed below. The geography of the practice and where they are, what schemes the FDs are applying to, what are the practices really like, and what to expect from the dedicated educational supervisor. Blue markers label the practices currently in the North East and North Cumbria. The schemes are roughly designated as their names suggest. For example, North covers mostly the northern part of the North East. The South covers the Teesside area. FDs when applying should check the addresses of the practices allocated to the scheme once practice listings are confirmed. Schemes to apply to. The North scheme 12 places, Central 12 places, South 12 places, West 12 places, GPT 12 places. What to expect from a training practice. Here is a website image of a typical training practice. FDs can research the practices via the practices websites. Each educational supervisor will present their practice online at a specific event to ensure FDs get an idea of the practices in more detail.
I'd only ever visited Newcastle twice, I think, before coming up here to choose my FD, but I wanted to move to the city because I love the city. It's got lots of things around it, but what made me choose this practice was initially I looked at all the locations to see how far I would have to travel because I knew I wanted to live close to the city. What links there was around, did I need to be able to drive, did I need to be able to get the metro, was it easy enough to get to, were the roads okay, etc. So after looking at where they were all placed on the map, even though we are described as the North scheme, a lot of the practices are actually central. A big thing for me was I looked at all the practice websites for my scheme. I knew that I wanted to be part of a large team because I thought, even though I know I'll have a trainer assigned to me, the more people I can learn from in the year coming out of university, the better, the more experience I can get. However, I know there are several people that like a close-knit and just having the 1-to-1 or 1-to-2 people being there in the surgery. So I chose Rivenhull practice because on the website I noticed they had 7 dentists, knew that it was going to be a big surgery. It was only a 10-minute drive from the place I'd chosen to live. Everybody looked really friendly. On the website they had a little description about all the dentists and the practice managers on there, and I just thought it looked a really nice practice. One really good thing here that they do in the North East is they have a matching event that you're able to go to. So what that entails is you'll go to a day down at Bourne House. They'll run, each ES will give a 5-minute presentation to the whole group, just explaining a bit about themselves, what their practice is like, giving you a feel for what it'd be like working there. So after all 12/14 ESs have give their presentation, you then get to go on like a matching event. So it sort of runs like a speed dating. You'll start off with one ES on a table, 1-to-1, and then after 5 minutes you'll move along. So in that 5 minutes you sort of get a feel for whether you'd be able to build a relationship. You get to ask questions yourself like, will the radiographs be digital in the practice? How have they felt being a trainer themselves? Do they enjoy it? You get to see if you get good communication, good feedback with them. And having to go one after the other, you're able to walk away from the event knowing, oh yes, with that trainer, we really had a good relationship. I want to avoid that practice. Knowing myself that I didn't want to be in a small practice and it was just one and himself and another dentist, for example. So knowing that you can sort of compare them all at the same time made being able to rank which practice a lot easier, and I really enjoyed the process.
The practices are specifically chosen for their high standards in all areas of patient care in terms of facilities and equipment for the FDs to work with. For example, they have experienced registered dental nurses, rotary endo equipment, own intraoral radiography and dental photography. Extra facilities that FD practices can provide are IVRA sedation, digital imaging, enhanced skills of team members, implant placement and restoration, Tier 2 treatment provision, plus visiting specialists. Some practices have attained recognition of their high standards through achieving the BDA Good Practice Award. This is a very aspirational reward. All practices are CQC registered. Some ESs will be affiliated with professional bodies within dentistry, and FDs are encouraged to join the local dental committee. Educational supervisors, your mentor for the foundation training year.
My name's David Wynn. I'm a co-owner of Rivenhall Dental Practice in Cramlington. I graduated in 2003 and I've been an ES on the North scheme for 6 years now. Initially as a joint trainer and for the last 4 years as a solo ES. My progression into becoming an educational supervisor started when I took a part-time role at Newcastle Dental Hospital supervising the final year students on the emergency clinic, and becoming an ES was a direct progression from my role there. At that time I got a real insight into how the final years thought about general practice, and I saw a real need for input in their training from a general dentist such as myself. Becoming an ES was a new challenge that came just at the right time for myself and my partner Tim, and it allowed us to really develop our practice. One of the reasons that I wanted to become an educational supervisor is it's become apparent over the last few years that new graduates in dentistry have much less clinical experience than when I graduated, and I felt that I could play an important role in developing new dentists and helping them sort of find their clinical skills and adapt to working as a dentist in practice, which is very, very different from being an undergraduate. The reason that I wanted to become an ES was to help new graduates develop from dental school to be able to work in general practice and make a living out of it. The life of a general dental practitioner is very, very different to what most new graduates expect it to be, and I think it's important for us to help make that transition as smooth as possible. Lots of things that are required to work in general practice just simply aren't taught at university, and foundation dentists really need enthusiastic educational supervisors to help them get a firm foundation to move forward. I also enjoy working with young, enthusiastic dentists, and it's a great experience to see a dentist develop from undergraduate to fully fledged dentist and go out and sort of have a full career based on what they've done with us.
All ESs have experience in NHS primary dental care. All have teaching and learning qualifications. Many have additional skills to assist FDs with their FD year in practice. You may have more than one educational supervisor. This is called joint educational supervisors. Your educational supervisor will provide 1 hour of protected time and 1 hour tutorial time each week, along with time to discuss all things related to dentistry during a working week. They will provide you with valuable feedback on your progression via assessments to cement your learning.